just the facts.
And now we present to you America's quintessential iconoclastic anomaly.
Wow.
In talk radio, your host, Joe Cristiano.
Welcome, everyone, to Liberty Talk Radio, America's libertarian voice, broadcasting from our studio in Tulsa, Oklahoma, to around the world. I'm your host, Joe Cristiano, and this is your antidote to popular talk radio. Folks, it's time for us to take control of our government now before this bureaucratic, oversized, and self-serving federal government starves us of our property, our freedom, our rights, and our liberties. But to do this, we must shed conventional thinking regarding our political structure. We need to be revolutionaries in thought, dissidents in action. Only after we recognize what our government is doing to our freedom and our Constitution will we start taking it back. And this program is just about that. Today, we are pleased and honored to have a returning guest, Dr. Elaina George. She's a Board Certified Otolaryngologist. She is an independent solo practitioner in private practice who is also a small business owner. She has a unique perspective on the problems of healthcare delivery, the true cost of healthcare, and viable solutions which seek to improve and restore the doctor-patient relationship, which is totally absent, by the way, in today's healthcare system. Today, we're going to talk a little bit about what's happening today with our healthcare system. Everyone seems to be on the fence. There's a lot of proposals. There's a repeal and unfortunately replace of Obamacare, and maybe we can get some insight to see what is going on and what should be going on. Dr. George, welcome back to Liberty Talk Radio. Can't you hear me?
I can hear you.
Oh, there you are. Dr. George, there you are. Okay, very good. Well, welcome back to Liberty Talk Radio. It's an honor to have you back.
Thanks.
Now, tell me, right now my blood pressure is probably 220 over 190 because of this healthcare system. Maybe you can lower my blood pressure by maybe explaining this to me. What is going on? It doesn't seem like we're making much progress. And I just wish that the Republicans, a couple of years ago, when they sent a health care package to do away with Obamacare, if you will, or the Affordable Care Act, why didn't they, and they presented it to Obama, they knew at that time that Obama was going to reject it. And they were going to come out like the Knights of Shining Armor and said, we did our best, we tried to repeal it, and he just wouldn't sign it. Why didn't they do the same thing to a Republican president, say, here's the package we gave to Obama, he wouldn't sign it, I'm sure you will, we'll get rid of this thing and maybe progress to a free market system. And I'm sorry for yapping so much, the program is all yours.
I think the honest answer is that they don't want to change anything.
Right.
You know, I think that they didn't have a replacement. They said they did, and they got called on it, and they had to come up with something. And this repeal, supposed repeal, this American Health Care Act that just got passed by the Congress this afternoon is not a repeal. It is a doubling down of the Affordable Care Act. You still have the mandated, cafeteria of things that need to be covered, mandated coverage. I think there's 10 things. You still have the government giving out subsidies to winners and losers, or creating winners and losers.
Right.
You've now done a shell game where before, under the Affordable Care Act, the young people were on the hook for paying for most of the cost of this healthcare debacle. It's now the seniors. They can be charged 5 to 1 differential in premiums compared to a young person. And so we haven't fixed this thing at all. As a matter of fact, I think they've actually made things worse.
Oh, it has.
For example, they don't cover, I'm not a Planned Parenthood fan at all, but if they don't cover abortion, and that's the government is not supposed to, they're removing coverage for Planned Parenthood, then by definition they're removing maternity care, wellness for women, etc., and it has nothing to do with abortion. But it makes it sound like they're doing something. This is what the whole thing reminds me of. They are talking a good game. They have no interest in changing the underpinnings of the system, but they want to make it seem like they did something. And they're going to blame it on the fact that they couldn't get the majority because the Democrats would fight them all the way. Well, it seems to me the Democrats put through exactly what they wanted to when they had their time in there without asking or caring about what the Republicans wanted, and they got it done. I'm not sure why the Republicans can't work the same way, especially when the country voted to remove this monstrosity that they want to call a health care bill. It still empowers the insurance companies. There's another little ditty in there, is that 30% surcharge is attached to anybody who goes for insurance after not having coverage for over 60 months. They're going to get 30% extra charged to them for a year just to carry insurance. I wonder if they're going to be able to afford the deductible or the co-insurance. They're only going to be carrying a piece of plastic and just saying, like they are now, that they have health care coverage, but it's not access to health care.
Yeah.
So, I mean, I'm not really pleased with this at all, I have to say.
Well, aren't a lot of people under the current system dropping out altogether and say, I'll pay the penalties, but I'm not going to pay for everybody else's health care? I mean, aren't they in an indirect way protesting a socialistic system? They're not saying that. They don't even realize they're doing that. They're doing it for monetary reasons, but that makes sense. You know, I'd rather pay a penalty, get me out of the system altogether. I'll worry about my health care. And thousands and tens of thousands of people are doing that, and that's what partially, from what I understand, crippled Obamacare.
It's true. That's part of the death spiral. The young people, the healthy people, had opted away from buying this stuff because it wasn't cost effective. They couldn't afford it. And those that did buy it, a very healthy percentage dropped it the next year when they could, because they realized it wasn't what it was chalked up to be. So we have a system that's propped up by subsidies, by government continuing to pay for things that nobody can afford. And when people get in that system, they're finding that their care is not the same as it was 10 years ago.
Yeah.
I have a friend who's in the hospital now with, who's got a kidney stone, and she's been in the hospital for over a week, and they still haven't treated the kidney stone. I mean, I don't even understand that. What are you talking about? This should never even gotten to the point that it's gotten to. And she went through the entire healthcare pathway, go to the emergency room, sent home instead of treating it. Then there's a complication where the person ends up in the ICU because it got infected, still not treated. And now as we're going on 3 weeks with the same thing, this is not healthcare like I remember training. This person would have been fixed within 24, 48 hours. If it still doesn't pass, you do something to get it done. And the system is just like this now. It's trying to grab money from people, slow walk people to a hospice, honestly. And you're better off not getting sick at all than accessing the system at this point. And it's not going to get better unless we as doctors and patients stop, spending our time, our effort, our treasure in this system that works against us.
Well, they vilify doctors. Let me give you an example. About 17 years ago, there was a fellow who was working, in fact, he's still working for me, one of my companies. And he had just come on. He must have worked there for about a week or two. And, no insurance or anything like that. He just came on. And it just happened that he was helping his mother start the car, an old car, a very, very poor kid, literally lived in a shack. Literally lived in a shack in a small town north of Tulsa. He was pouring gasoline into the car when a spark, lit the gasoline, burnt his entire body. I went to see him in the hospital. They did not think he was going to live. His blood pressure, I don't recall what it was. I want to say it was such a low number. He was almost dead at that point. That it was like double-digit numbers, And they didn't expect him to live, but he did live. Well, he had no money at all. He was dead broke, but he was a good kid, And they treated him. He survived the hospital stay. In fact, today he's perfectly healthy. In fact, he still works for me. He's getting married next year and the whole bit. And he promised to pay the hospital a small amount, whatever he could afford a month. And I think it was like $50 a month or something like that, until the entire bill was paid. Well, after a few years, I think like 5 or 6 years, paying the $50 a month or whatever, they sent him a letter, said, thank you for being consistent in your paying and being current on your paying. We are writing the rest of it off. Now, there's a case of the free market system working. He promised to pay, and he would have continued to pay until it was all paid off, but they didn't make him die. If you listen to the mainstream television, if you are dying and you don't have the right health care, you're going to die. Everyone walks out of the room, and that's not right. I don't know. I have many friends that are doctors. None of them would let their patients die if they didn't have any money. They would all treat the patients, even if it cost them money. Every single one of them. I don't know where they find these doctors that allow people to die. And in fact, many of them go overseas and help people overseas that can't afford health care, and they assist in countries that have no health care at all. And they do that on their own dime. Where are these doctors who are just looking around waiting for people to die because they're not getting paid enough?
They're in the VA. They're in the government health
system.
That's where they are.
Probably so, right? Okay.
Listen, in Georgia we have something called Bridge to Atlanta, where you can be seen for free. I don't care if you have cancer. I don't care if you have a tumor. I don't care what you have. Dental, eye. We are a network of doctors in Georgia that volunteer our time and give our services. And if you do work and you can afford to pay something, we take what you can afford. This is happening all over the country. They make it sound like doctors are waiting for people, to pay for their next mortgage payment, otherwise they're not going to care for them. But this is all about emotion. This is what you do when you don't stand for anything. You try to drive people to do what you want them to do through fear, anger, jealousy. It's every bad emotion that you can possibly gin up in somebody. And as soon as you start getting emotional about something, you no longer can deal with anybody in a reasonable manner.
Right.
We have EMTALA, which is called the Emergency Medical Active Labor Treatment Act. And there's nobody in this country, whether they're here legally or not, who can walk into an ER, not be cared for irregardless of their ability to pay. So nobody dies in this country. If you walk in and you are in any kind of extremist situation, they will stabilize you. They will make sure that you are cared for and not ask you for how much money you're going to pay them. And that's throughout the country. We're in a position where the problem is the cost of healthcare is completely artificial. This Healthcare Act does nothing to fix that. Why should it cost people 10 to 15 or more times more to get a procedure or service in a hospital versus an independent freestanding location? Whether that's an ER, urgent care, whether that's a surgery center, radiology center, a lab, a doctor's office, it is multiple times more expensive if it's hospital-based or hospital-owned. And there's no reason for that, because they have the power, because they have the ability to cloak their prices, because you go in there and they stick you with a bill at the end of the visit, and you don't even know if half that stuff was actually done. But it's now the patients really need to become consumers. I can't stress that enough.
Yeah.
If you have an idea of what the value of something is, and you can tell if you go online, if you go to the American Association of Physicians and Surgeons, if you go to jointhewedge.com, if you go to MedRetreat, all of these are examples of websites that list their prices online. A Surgery Center of Oklahoma. So if you're going to get a gallbladder surgery tomorrow or the next week, you can go online and look at what the actual cost should be, and then go back to the doctor that you're having it done with, especially if it's a hospital-based doctor, and ask them, how much are you charging me for this? And if they can't tell you what the cost is until after you've had the service, you need to walk out the door.
Right.
Because they're making it up as they go along. These facility charges, which are ingrained in hospital bills, are completely false. Let me give you an example. If I sell my practice to a hospital, I own all of my ENT equipment. The hospital buys my practice. The hospital owns all of my ENT equipment, right?
Right.
Well, they're charging for every scope a differential, a facility charge for using equipment that's already purchased, already owned. They're not paying a dime for, but they're charging a facility fee for using that instrument. Whether it's my audiology booth, whether it's my scope, but if I were a family care practice doctor for my EKG machine, that's ridiculous. You shouldn't be paying $300 for an EKG when it should be $20. That's what they're doing to patients, and nobody's saying a thing about it.
Yeah.
And it goes on with the pharmacies, with the pharmacy benefit management companies, We have now an entire system, a feeder system, that has monetized doctors and monetized patients, and their only goal is to figure out how they can get into this trough and start feeding as well.
Yeah.
And the newest, snake in this pit is the Health Information Technology Group, the electronic medical records folks. They have a scam going that you wouldn't believe. They're saying that we have to have electronic medical records, but they don't talk to each other. So I have had 3 versions of an electronic medical record system because they're not very good. And the last one that I had, they wanted to charge me $10,000 just to have my patient information transferred to the new IT system. Now, are you kidding? I would go bankrupt trying to do something like that. So imagine doing that to every small doctor in the country.
God. Yeah.
It's a scam.
Yeah.
So we did it by hand. It took us weeks to do it. We downloaded onto a server our own, and we managed to, we had the time and the will to do it, but that's crazy, right?
Right.
It should be, once your information is there, you can transfer it to anybody you want. It should be push of a button. It's not.
And people don't realize that the government health care creates cost. My wife is an audiologist, and she had 3 offices. Now she has 2, and she goes to assisted living places and helps people. And she totally divorced herself, cash only, and it's cash only, or she does it for free. And believe me, she does a lot of free work. People come in, they can't afford it, she does it anyway. And even if they need a hearing instrument, she will find something for them, something that's so reasonable, something that may not be the latest technology, but is really good stuff. I mean, better than average, and she'll say, pay what you can. And 9 times out of 10, people pay $10 or $20 a month or whatever. It's fine with her. I mean, she works with. But if you listen to the people on the boob tube, all you guys are raking all the money out of our wallet, and all they care about is how much they can take from us. They don't care about, you don't care about your patient, you just care about how much money you make. But this is the impression that they give. And I had a lot of friend doctors, they're all like you, they're all like my wife. They don't do this. I mean, they do the exact opposite. In fact, in most businesses would not be as lenient as the medical profession is in private practice. And I can never forget this one time I was helping my wife. I'm going back 25 years ago almost. And probably about 20 years ago. And I was helping her out. And my wife has an office in Pryor, Oklahoma, as well as Tulsa. And she had one in Owasso, which is closed now. And this woman made an appointment, so I got the appointment book out, and I'm trying to help out. I don't know what I'm doing, but I'm trying to help out, And I wrote down the person's name because her telephone number was from Pryor. I recognized that, so I put her in the Pryor book. I said, okay, she'll be there Wednesday, whatever. She said, oh, no. She says, I don't want an appointment in Pryor. I want an appointment in Tulsa. I said, but you only live a couple blocks from the office. She says, I know. I said, well, you can just walk there. She said, but I'm not kidding you. You're not going to believe this. This is going to sound false, right? And she said, you don't understand. She said, if I accept the appointment in Pryor, I have to get my friend to drive me there. If I accept the appointment in Tulsa, the state will pay for a van from Tulsa to come to Pryor, which is an hour away, pick me up, bring me to your office, wait for me, and then chauffeur me back again. I'm not kidding you. I'm not making that up because it's so ridiculous. I would be a fool to make it up. I got so angry. I didn't say anything to her. I said, okay, fine. Thank you very much. I hung up. I told my wife, I said, I can't handle this. I cannot handle this. She said, cancel the appointment. We don't take her. And she never took her. She said, no, she's not coming here. She says, we are not going to pay to have her be limousined around, And from that day forward, my wife canceled all sorts of government subsidies. She said, we're going to be cash only. But people don't realize that people are gaming the system and everyone else is paying for it, and they're paying 10 times as much. I had a steroid shot in my knee. This is about 8 years ago. And I just asked the doctor, I said, out of curiosity, both knees, because I used to be a triathlete and I wore out my knees like crazy. And I said, how much is the steroid shot? It took him 2 seconds to do. You know how you're bingo, you're out in 5 minutes, He said $1,000. Well, I blurted out a word that I will not repeat on the radio. It was just going, came right out of my, and I yelled it. I said, and I said, $1,000 to put a shot in my knees? They said, no, not really. That's $1,000 per knee.
Oh.
$2,000 for a steroid shot. And I said, how much? I forgot what he told me the steroid shot. It was nothing. It was a nothing burger, as they say, on Shark Tank, a nothing burger. And they said, why? They said, welcome to our new healthcare system. And people don't realize that. And yet on mainstream television, they don't talk about that. They talk about what bill should be signed and whether or not this senator said this and said that and whether they should sign this. But no one talks about the free market system and how much the government program is raping the heck out of everyone.
It's not just the government program. It is medical insurance.
Right.
You think about what they stand for. Their job is to help you pay for high medical costs. Does it serve them if the medical cost is $60, or does it serve them if it's $6,000? Their reason for existence is the high bill, because it makes the patient believe that I can't do it on my own, that I need this third party to help negotiate it for me, when in actuality that third party is the number one reason that the costs are so artificially high from the get-go. The insurance companies don't want the prices to drop. I had a conversation with a lawyer about ERISA. That's the employer-owned insurance plan. So the employer contracts with Blue Cross, Aetna, whatever the insurance company is, to administer the healthcare plan for their employees. And my thought was, well, wouldn't they want to negotiate rates with doctors who are going to give them a discount? Why aren't they preferentially using the independent doctors who cost less? And I was told in no uncertain terms that's not what what ERISA or the insurance companies want. They want those prices to be as high as possible so that they look like the good guy in taking back to the employer, we've got you, the $6,000 bill, we got it down to $2,000, aren't we awesome? Don't you need us? As opposed to going into an independent doctor where that same injection you told me is $2,000 would have been about $60, maybe 100 tops. I doubt it would be that expensive.
Yeah.
So this is the system. We've relied on people, just like Congress, if you want to be honest, who are supposed to have our best interests at heart, who are supposed to work for us, who once they get in a position of power, literally work day and night to stay in power and to keep their feet on our necks. And in terms of a doctor's standpoint, I honestly believe we're still moving probably at a faster rate towards single payer, because this Healthcare Act, American Healthcare Act, is not going to work. You're kicking out people who were covered before. People in Medicaid will no longer have, the cap in Medicaid is going to drop. So they're going to have less money for Medicaid coverage, which means those patients already getting crappy care are going to get worse care.
Right.
The people who, the young people are going to be paying more money. The older people are going to be paying more money. They're paying a bailout to the insurance companies. And as this unfolds into 2020, 2021, there's going to be an outcry for fix it. And the fix it will be single payer. So the Democrats have opened the can of worms. The Republicans have heated them up. And we're going to, reap what they sow unless we, as individuals, patients and doctors, get away from the system now while we still can. The free market system exists, Joe. It's already there. Mm. You can go to any of the websites I spoke about. You can join a Christian sharing ministry, a direct primary care practice, and you can not even worry about any of this stuff. I don't think about this as an individual or my employees or my friends who have joined health sharing ministries. It's irrelevant to us because we're parallel to this. We're in a system where the prices are transparent. They are quantitated. They're not they don't gouge people. And it's where consumer-driven medicine lives, where you want to treat your patient like gold because you want your patient to come back, as opposed to I have thousands. Who cares if you come back or not? Yeah. Which one would you choose if you had a choice?
Yeah. Every doctor I know cares about their patients. I mean, the impression they give you is that those doctors are in there, those slime balls are in there just to get as much money as they can out of you. They don't care about. I mean, they give you the exact wrong impression. Everyone I know, I mean, would do anything to save a patient, even if it cost them money. Even if they never got paid, they would do it. But you never hear that. And a couple other things you never hear on mainstream television, including Fox News, and Foxless News, I should call it. But is you never hear the term socialized medicine or free market medicine. You never hear those two. You always talk about, they use weasel words so that they disguise it to hide the fact that this is socialism, because that's a bad word, a bad term to use here. So we have single payer system. We have all these other terms that we use. We don't use the term socialized medicine because this is the United States and it's a free country, which it's not. And they will not talk about anything else. Hold on a second. We have a call? Oh, 4 minutes to go. Okay, I thought we had a call. Okay.
Well, let me just say, the Medicare system is socialized medicine.
Right.
That was the experiment, and that was supposed to be the foundation for expanding it throughout the healthcare system. I mean, this is not just happening since the Affordable Care Act. This has been a slow-growing, slow unfolding movement towards it. That was just a stimulus, to try to goose it to go faster. But this has all been in the works for a long time, and 20 years at least. And I was, as a medical student, I saw everything happen. My professors told me how this was going to roll out. Couldn't believe it, but they're absolutely right. Yeah. When healthcare became 50% women in medical school, they said, hey, you're not going to get paid as much. This is going to be completely different. You're not going to have autonomy, and they were right about that. The next thing we know, we have the insurance companies becoming doctors. They are literally practicing medicine by saying what's allowed to be covered and what's not allowed to be covered, what's medically necessary. They're not supposed to be doing that. Are they in the office with the patient with you? No. But they have the ability to deny care. And I think one of the things that could really change this would be to take the onus off of the doctor. If the insurance company denies care for something and something bad happens, then the insurance company should be sued for practicing medicine.
Right.
Just like the health information company. Right. If your records get breached and held out there, blackmailed, and your information gets out there, the health information technology company should be sued, not the doctor. That would change the entire ball of wax. Yeah. And we would have patient-centered care again, because right now the doctors are taking the heat and the responsibility for everything. If an MA or a PA or a nurse practitioner or anybody else does something, it's on us. They're not necessarily getting sued. We are. And that needs to change. We need to get our power back as physicians, because we've really given it up throughout these last 20 years. And part of it's our fault. We just kept our heads down. We just wanted to see our patients and do the right thing. And we let all of our autonomy, our profession erode around us. And we become cogs in a wheel, those of us who've given in to that. And none of them are happy. Otherwise, you wouldn't see 400 doctors committing suicide every year.
Oh,
and medical students now joining the ranks.
Yes.
So there's something wrong with the healthcare profession. And algorithms and Watson is not going to fix it. Now,
a friend of mine who is an anesthesiologist said that a very small portion of the doctors today actually belong to the AMA. And I forgot the percentage, but it was very, very small.
5.
I thought all doctors belong to the AMA. He said, no, closer to 10% or something like that.
No, it's lower than that.
It's lower than 10%. Okay, so I didn't hear wrong. Okay, my hearing is still okay.
I don't belong to it.
Yeah, and that's amazing. And I guess because the AMA, they consider the AMA the enemy now and not representing them.
They don't. They're a lobbying group that represent themselves. They make more money selling the coding system for the insurance companies to use than they do in dues. So they could care less about doctors. They're about policy, about making themselves important, about putting more regulations in place that they can monetize. They sell these coding books to United Healthcare. United Healthcare is one of the major players in the whole healthcare system. They have a finger in every pie, every delivery system. It's not working. Bigger's not better. Centralization is not better. Standardization of patient care, like where a conveyor belt, doesn't work because a human being is not a machine. And it needs to stop. But the only way that we stop it is to get off the train.
Right.
And this starts with the patient. Do you really want to take 20 medications? Do you really think that you need to take that many medications to stay healthy? I'm just asking. I don't. And my radio show, Medicine on Call, I've said on multiple occasions that anybody listening, I actually encourage you to go to your doctor, take your bag of medications with you, and ask that doctor, why do I need to be on these medicines? What can we do to stop them? Because a lot of people are on medications for the side effect of one of the medications that they're taking. I mean, we can clean house. I mean, just think about this for a second. An 80-year-old who's diagnosed with a little bit of elevated blood pressure, maybe it's 130 over 80 or 140 over 80, whatever. They're 80. Do they need to be on a couple of blood pressure medicines? They obviously did well to get to 80. So we're treating people with too much, and we're basing our treatment on numbers. And those numbers are being generated by the pharmaceutical industry who underwrites these research studies. It's such a huge onion. The more you unpeel it, the more disgusted you get, to tell you the truth.
Yeah.
But you can say no. You can take your power back. You can refuse to go down the line, whether that's not taking all the medication that they want you to take. And if there's a natural approach to something, do you really need to get the vaccine? Ask a question, for goodness sake. Nobody gets into a doctor's office. First of all, they don't have enough time. 7 minutes is the average visit. But for that 7 minutes, you should exert your individual power.
Very good.
Ask your questions.
Right.
If they don't give you the answer that you want, if they treat you poorly, move on. Because it's one of the things that the free market, really empowers the patient to be, is the consumer.
Right.
I can't be a doctor if I don't have a patient. I want your business.
Right.
I need to do what I need to do to make you happy. And if I don't, then I got competition. The hospitals and the government they don't believe that they have competition.
But don't we need the government to protect us from you? Don't we need the government to protect us from you? But that's the message that goes out, is that we need the government to protect us from you.
But think about how the government operates. The good of the many outweighs the needs of the few.
Yeah.
They have a finite number of resources, a finite amount of money that comes in. And their job is to give you the least and keep the most in their pot for the good of everybody.
Yeah.
Right? So look at Medicaid, look at how it's structured. When I become Medicare age, and I don't want Medicare, because I'm good, I want to handle my own business, I don't want it. I will lose Social Security benefits if I don't use my Medicare, if I don't take my Medicare benefits. What kind of system is that? It's completely mercenary. So it puts you on a dependent scale of, I won't get what I earned as a Social Security recipient because I won't take Medicare. So I'm stuck, technically.
Right.
You're not.
Right. Yeah, they buy you into a system.
You're not getting all your money's worth either, which I really disagree with. But that's how the system's set up. It's set up to make you codependent, to take away your ability to think for yourself, to make you powerless. And somebody else knows what's best for you. Somebody else will take care of you. No one cares more about you than yourself. You need to get off the train of the government loves me, the insurance companies love me. No, they don't. They don't. They love your vote, and they love your money.
That's right.
That's about it.
That's right.
Wake up.
My primary care physician I've known for about 32 years. I used to enjoy going to him, for my yearly, checkup or whatever, and we had a great time, and the past few years I loathe going to see him, and not because of him. He is so downtrodden. He is treated like a low-level nothing. Last time I was there, he was so angry because he got fined for writing a prescription out and failing to put it on the computer. I mean, so the administrator now is his boss, is the administrator, is his boss, and so he has to do what the administrator tells him to do to the patient. And I go there and we hardly speak. He said, and he tells me, he said, we have 15 minutes, you have 3 questions, I have to do this, and we're finished. I mean, he just go there, and I hate going there. I just hate going there anymore. I mean, and it's not him, it's the system that's doing it. Well, anyway, we're close to our witching hour right now, Doctor. Now, do you have any any closing remarks, or you have any projection as to what's going to happen to give us some insight in that?
You know, I don't know what's going to happen in the Senate with this law or bill. It's not a law yet. I don't know what's going to happen when it goes through that. But I would counsel people, don't wait for this to unfold. It's not worth it. If you're healthy, even if you're not all that healthy, you should look into the health sharing ministries like Liberty Health Share. If you go to libertyoncall.org,
right,
that is a perfect example of being able to control your pocketbook and have the autonomy to pick whatever medical track you want, whether it's holistic, it's medical tourism, it's direct primary care, whatever you want, and you're not locked into a system. If I want to get treatment in Sloan Kettering, God forbid, I can. If I want to go out of the country, I can. If I want to do, a Chinese herbal qigong, I can.
Right.
I can't do that with any of the the commercial insurance companies now. I am within the letter of the law because it's written as an alternative that's allowed under the Affordable Care Act and even the American Health Care Act. So these are things you can do now. You can buy a supplemental policy. I've talked about it before. Aflac is a perfect example. Medical Mutual has it. I'm sure other ones do as well, but I can speak for Aflac, where you can buy a policy that will cover you for any diagnosis, whether it be cancer or heart attack or admission into a hospital, where they're going to pay you in case you get sick.
Right.
That will give you the ultimate power so that you can get as much treatment the way you want it and not have your bank account completely just destroyed.
Yeah.
You don't have to play this game. Go to my website, drelainageorge.com. I've been writing blogs for years on this. And you can also look at the links to all the things I've spoken about. Listen to my show, Medicine on Call. We had an excellent show on diabetes and high blood pressure and how they're being overtreated and overdiagnosed. These are things that if you don't know, you can't make a conscious decision. Nothing fits everybody. There is no one size fits all. You may like the Affordable Care Act. Good for you. But if you don't have to worry about being stuck in it. Right. I'm here to prove that there's an alternative.
Yeah. What's going to be interesting is if, there are many financial people who project that we are heading into a financial crisis just because of the looming debt over our heads, which, long-term and short-term and unreconciled debt, whatever that's supposed to mean, is approaching $250 quadrillion. And they said it's going to snap someday. And when it does, the healthcare system is going to go with it. And we're not going to have a choice but to go back to a free market system. And maybe that'll happen at that time. But on that cheery note, I'll conclude this program. Dr. George, I want to thank you so much for being on our program. I really enjoy having you on. And I do hope that you will accept our invitation to return at a later date and give us an update of what is going on.
Always. Thank you for having me.
Thank you so much, Dr. Elaina George. Folks, this is the end of today's broadcast. We'd like to thank our sponsors for the financial support, and we'd like to thank you for listening in. You can further the cause of liberty by recommending this program to your friends, and let us hear from you. Our email address is comments@libertytalkradio.com. Remember, as my wife would say, you are either allowing your liberties to be taken away or you're striving to protect them. Unfortunately, folks, there is no middle ground. Please look at our website, subscribe to our reminder service so you'll know when we're on. Look at us on YouTube. You can subscribe to our YouTube channel as well. And of course, if you ever want to make a donation, please send me as much money as you'd like. I'd love to accept it. It'll go to the program. Until next time, this is Joe Cristiano. You've been listening to Liberty Talk Radio. Stay well. Stay tuned.